Diabetes doesn't always come with clear warning signs, especially for women. Recognizing these 8 common signs is like unlocking a secret power. Let's dive in and discover them together. Number 1. Frequent urination and thirst. Frequent urination and thirst are pivotal signs of diabetes, deeply rooted in the body's impaired ability to manage blood sugar levels. In diabetes, excess glucose in the bloodstream leads to an increased workload on the kidneys, which strive to filter and absorb the glucose. When they can't keep up, the surplus glucose is excreted in the urine, pulling water from tissues and resulting in dehydration. This process triggers a cycle of increased thirst and urination as the body seeks to expel the glucose and rehydrate. Managing these symptoms effectively involves meticulous blood sugar control. Regular monitoring and adhering to a diabetes management plan, including medication, diet, and exercise, can help stabilize blood sugar levels. Increasing water intake is crucial to counter dehydration, but it's also important to balance fluid intake with the risk of exacerbating frequent urination. Consulting with healthcare professionals for personalized advice is key, as they can adjust diabetes management plans to mitigate these symptoms, improving quality of life and preventing further complications. Number 2. Yeast infections. As we continue, please subscribe to this channel if you're finding this video helpful. Thank you. Yeast infections emerge as a common sign of diabetes in women, intricately linked to elevated blood sugar levels. The body's moist areas, particularly the vaginal region, can become breeding grounds for yeast when glucose levels are high. This happens because yeast feeds on sugar, and an excess in the bloodstream can lead to overgrowth, resulting in infections. These infections are characterized by itching, irritation, and discharge, indicating an imbalance in the natural flora. Managing yeast infections effectively requires a multifaceted approach. Firstly, maintaining controlled blood sugar levels is paramount, as it reduces the primary fuel for yeast growth. Over-the-counter antifungal treatments can alleviate symptoms, but recurrent infections necessitate a doctor's visit. Additionally, adopting breathable, moisture-wicking clothing and practicing good hygiene can prevent the conditions that allow yeast to thrive. Together, these strategies not only manage but also mitigate the risk of future yeast infections, offering relief and promoting overall well-being. Number 3. Polycystic ovary syndrome, PCOS. Polycystic ovary syndrome, PCOS, is a significant indicator of diabetes in women, primarily due to its strong association with insulin resistance. PCOS is a hormonal disorder causing enlarged ovaries with small cysts on the outer edges. Insulin resistance, a common trait in PCOS, impairs the body's ability to use insulin effectively, leading to elevated blood sugar levels and increasing the risk of developing type 2 diabetes. Managing PCOS and its related symptoms effectively involves a comprehensive approach that targets both the symptoms and the underlying insulin resistance. Lifestyle modifications, including a balanced diet low in processed foods and sugars, regular physical activity, and maintaining a healthy weight, are foundational. These changes can improve the body's insulin sensitivity. Medical treatment may include medications to regulate menstrual cycles, manage symptoms, and metformin to improve insulin resistance. In some cases, fertility treatments may be necessary. Consulting with healthcare providers for a personalized management plan is crucial for women with PCOS to mitigate their risk of diabetes and enhance their quality of life. Number 4. Weight changes. Weight changes, particularly unexplained weight loss or difficulty losing weight, stand as significant indicators of diabetes in women. This phenomenon occurs due to the body's inability to efficiently use glucose for energy because of insufficient insulin or insulin resistance. When cells are deprived of glucose, the body begins to burn fat and muscle for energy, leading to weight loss. Conversely, insulin resistance, often seen in type 2 diabetes, can make it challenging to lose weight due to the body's difficulty in using insulin properly. Managing weight changes effectively as a sign of diabetes involves a comprehensive approach that includes dietary adjustments, physical activity, and medication management. A diet rich in fiber, whole grains, lean protein, and vegetables can help manage blood sugar levels and support healthy weight management. Regular physical activity improves the body's insulin sensitivity, making it easier to maintain or lose weight. Additionally, medications may be prescribed to help manage blood sugar levels, which can also support weight management goals. Consulting with healthcare professionals for personalized dietary and exercise recommendations is crucial to effectively managing weight changes related to diabetes. Number 5. Fatigue. Fatigue in women with diabetes is a direct consequence of the body's inability to efficiently convert glucose into energy. When insulin is insufficient or the body's cells resist its effects, glucose accumulates in the bloodstream instead of being utilized as fuel. This mismanagement leads to energy shortages within cells, manifesting as overwhelming tiredness or fatigue. Moreover, high blood sugar levels can induce inflammation and increase oxidative stress, further contributing to feelings of fatigue. Managing fatigue involves addressing its root cause, the imbalance in blood glucose levels. A strategic approach includes monitoring and maintaining blood glucose within target ranges through medication, diet, and exercise. Consistent meal timings and incorporating a balanced diet rich in nutrients can stabilize blood sugar levels. Regular physical activity enhances insulin sensitivity, aiding more efficient glucose use. Adequate hydration and prioritizing sleep are also crucial. Additionally, stress management techniques can mitigate fatigue by reducing stress-induced blood sugar fluctuations. Number 6. Slow healing of wounds. Slow healing of wounds is a prominent sign of diabetes in women, stemming from the detrimental effects of prolonged high blood sugar levels on the body's natural healing processes. Elevated glucose can impair circulation, reducing the blood flow necessary to deliver nutrients and oxygen to wounds for effective healing. Additionally, high sugar levels can weaken the immune system's ability to fight off infections, further delaying wound recovery. Managing slow wound healing involves comprehensive diabetes control to prevent high blood sugar levels that exacerbate this condition. Key strategies include strict blood sugar management, regular monitoring and maintaining blood sugar levels within recommended ranges, proper wound care, keeping wounds clean and protected to reduce the risk of infection, enhanced nutrition, a diet rich in vitamins and minerals, especially vitamin C, zinc, and protein to support wound healing, promoting circulation through regular, gentle exercise, and avoiding smoking to improve blood flow and aid in healing. Engaging with healthcare professionals for personalized care plans is essential for adjustments in diabetes management and wound care strategies to effectively address slow healing wounds, enhancing recovery and minimizing complications. Number 7. Numbness or tingling in hands and feet. Numbness or tingling in the hands and feet, known medically as peripheral neuropathy, is a prevalent sign of diabetes in women, resulting from high blood sugar levels damaging nerve fibers. This damage primarily affects nerves in the extremities, leading to sensations of numbness, tingling, or even pain, reflecting the body's response to the impaired transmission of signals due to nerve injury. Managing this condition requires a proactive approach to control blood sugar levels, as stabilizing these can prevent further nerve damage and alleviate symptoms. Incorporating a balanced diet, regular physical activity, and medication adherence are fundamental steps. Additionally, foot care becomes crucial to avoid complications. Regular inspection for cuts or injuries, wearing comfortable shoes, and maintaining good hygiene can mitigate risks. Pain management strategies, including medications, physical therapy, or acupuncture, may be recommended by healthcare providers. Consulting with a healthcare professional for personalized management strategies is vital, allowing for adjustments in treatment plans to effectively address numbness or tingling and enhance quality of life. Number 8. Skin changes. Skin changes in women with diabetes are indicative of the body's struggle to manage high blood sugar levels, leading to a range of dermatological issues. High glucose levels in the bloodstream can lead to dryness, causing the skin to become itchy and irritable. Moreover, diabetes can prompt conditions like acanthosis nigricans, characterized by darkened patches of skin, particularly in folds and creases. Such changes not only signal diabetes, but can also increase the risk of infections due to skin being more susceptible to breaks and wounds. Managing skin changes involves meticulous blood sugar control, as stabilizing glucose levels can mitigate many skin-related symptoms. Hydration is key. Drinking plenty of water helps maintain skin moisture. Regular use of moisturizers can alleviate dryness and prevent cracking. It's also important to practice good skin hygiene and protect skin from excessive sun exposure with sunscreen. Should skin conditions persist or worsen, consulting a dermatologist is advisable. They can offer targeted treatments and recommend specialized care routines to manage diabetes-related skin changes effectively, enhancing skin health and comfort. Understanding these 8 common signs of diabetes in women is the first step towards empowerment and proactive health management. By recognizing and addressing symptoms early, women can navigate their health journey with confidence. Remember, knowledge is power. Embrace it to champion your well-being and lead a healthier, more balanced life. You might also want to watch more videos on diabetes signs in women. And please subscribe to this channel if you found this video helpful. Thank you for watching.